in alignment with what how you understood today to go. Yeah, wonderful.
Yeah.
So as we have the conversation, there may be time later at the end for folks to jump in and ask more questions. We really do hope that this is a conversation. And so feel free to add on to each other. You know each other best. You know who can speak to what. There is no sort of right way in this conversation. Really, what we're trying to do is broaden the network, deepen our understanding of what early relational health looks like in communities. And your team was identified as a group that's doing this work and that we can learn from or partner with. And so that's what this is all about. Any questions before we get going? No? Wonderful. Okay, so we know that you're part of the Pediatrics Supporting Parents National Project, and you're located in Durham, North Carolina. We spoke to the Washington State group a few months ago, but we would love to learn from you sort of what it looks like, what the work looks like for you, how you came together, and what you're all about. Before we sort of jump into that, it would be really nice if everyone could introduce themselves. So why don't we get started? Danielle, you're sort of in my top corner. Would you like to tell us a little bit about you and what your role is in the work and what sort of compelled you or inspired you to be part of it?
Yeah, thank you. First, thank you so much for the opportunity to speak with you all. We have been really excited to just share a lot about our process and how we're loving on this work. Personal experience really brought me to the field of maternal child health and just really inspired the passion for the work. I am a maternal child health consultant and program director for the PSP initiative here in Durham. And I spent the greater part of, let's see, 15 years so supporting and promoting like maternal health, and have spent really these last few years just leaning into the bridge work of maternal and early childhood work. And that's just kind of where I live. I do some doula work and childbirth education work and lactation work. So I still have that maternal hat, but I'm really leaning into this collective impact and early childhood work that we're doing in Durham.
Oh, nice to meet you. Would you like to pass it to the next person?
I popcorn it to Ellie. I saw her come off.
Yeah. I'm Ellie Erickson. I am a general pediatrician at Duke. I'm also a mom to two little kids who are 3 and 5. And so the early childhood part of things is definitely incredibly close to home. I am one of the sort of, clinic on the ground liaisons practicing in the clinic where our interventions are based. And I will pass it over to Tiffany.
Well, I'll say similar to Danielle, lived experience brought me here. In fact, this year I'm actually, I left my 12-year job, corporate job, to do this full time. Had my third child born with, we thought he was going to be completely blind. He ended up being legally blind, partially deaf, and autistic. So my experience kind of moving through the network, navigating it was a nightmare. There had to be a better way. And I was happily tapped to kind of tell my story, and that turned into a few different opportunities. And so it's a passion of mine. I'm advocating for change and for better processes, and that's what I'm working on here. I'm going to popcorn it to Catherine.
Hey, so I'm Catherine Cannon, and I am sort of adjacent to the rest of the folks from our team are really the core team that have been doing a lot of the PSP planning work since it came to Durham. But I am the project director for a SAMHSA launch funded project that is focused locally in Durham on promoting social emotional health. And I've been doing that for the last 4 years. We're a 5-year project. One of the components of our project has been supporting a healthy step specialist at the clinic where this work is happening. Yeah, and so I got to be part of the team that sort of saw this opportunity and helped figure out what it could look like in Durham. And then I have just been, because they have the same ultimate goals really that we do around early childhood, have been really happy to watch it develop and support as I can and work on keeping the connections between this team and this initiative and some of the other initiatives around early childhood and around early childhood social emotional health specifically in Durham. Yeah, I'll leave the introduction there and pass it to Debbie.
Thanks, Catherine. Hey, everybody, I'm Debbie Best.
She is outside. Zulma, do you want to go ahead while we're waiting?
Yeah, sure. Hi, my name is Zulma Galdanas, and I am a parent leader for the PSP group in Durham. I have 4 children, and mostly the last one has brought me here because I have had to
all of the children in Durham has been really important to me, and is why this really resonates with me. I am getting an unstable internet connection here, but I think my power
lost
just
you for a
back.
minute. Uh-oh.
Uh-oh.
Go ahead, Zulma.
Back to Zulma, yeah.
Okay, so like I was saying, with her having medical complications, it has made me be more in the health system and see a lot of things that definitely need attention, especially when we're having such a hard time with our child. And I'm really excited to work with everyone about being able to speak up and actually say what we need or what we need to look into to better everything for our children, which is what's most important. And I will, I guess, who else is needed?
That's us. Yeah.
Yeah, we've met.
Oh.
Steven and Mia will probably stay off video unless they have questions towards the end, but they're listening. It's really nice to meet all of you, and what a dynamic and a group that you have, clearly with a lot of passion for the work. It would be helpful for us to just learn a little bit more about what PSP actually is. What do you do? How did you come to be? What was the need that was noted? You know, a little bit more context and sort of painting a picture of what the day-to-day is all about. Who would like to?
I'll take this one. I'll take this one just to give the elevator speech, and then hopefully maybe Debbie or Catherine can jump into essentially PSP or Pediatrics Supporting Parents. The goal is to transform well child visits to include and improve early relational health and social emotional development in families that have children from birth to 3 or that early childhood of birth to 8. And that's kind of like the overall premise. We're specifically in the Duke Children's Primary Care at the North Duke Street Clinic in Durham, North Carolina. But that's just like the overall goal there. But Debbie and Catherine and Ellie were in here.
I'll jump in for a second, Danielle. Also intentionally I'm just adding on to the end of Danielle's statement, by the way, intentionally with a focus on bringing parents to the table about those visits and how they go and what's working and what's not working. And then with us all together kind of applying what we know about social emotional health and early relational development, and just taking that opportunity to kind of teach it, demonstrate it, mold it, send it out there. So I'm going to pass it to either Debbie or Ellie.
I mean, I think just the acknowledgement that like we think that we're doing a lot in pediatric primary care, but we know that two things are probably true. One is that we are not doing enough to support early relational health practices and positive parenting, and even discussing with families what that is and why it's important. So how do we do that better? And also understanding that our impact only goes as far as what families and communities may or may not be doing to support those practices in their homes, right? Like our 15 minutes in clinic with a family is a small, teeny tiny fraction of the time of their lives. And so really wanting to make sure that the interventions, that the way we're talking about this in clinic resonates, hits home, is culturally affirming and appropriate for conversations with all the families that we're working with. And so that's why we need parents as partners, right? We can't just say, here's how I feel about early relational health. Don't you agree? Or here's how I feel about early relational health, and you should do it too. Like that's not gonna work. So how do we fix that?
Yeah, and I think the other piece that you hit on, Ellie, that is so humbling as a pediatrician is the realization that we can't do it all alone, and that we need to extend that notion of the medical at home to include the dimension of the community, and really be bringing all of those resources to bear on child health. And I think, we get taught in school, here's the problem, here's how you fix it. And particularly for things like supporting social emotional health, as Ellie mentioned, it's not a checkbox, it's not a prescription, it's a longitudinal relationship with family, with the community, with the resources that exist. And I think that's one thing that we all felt, when we looked at the PSP opportunity. There were a lot of us doing this work and already engaged and working together, that it felt like a natural opportunity to really highlight even further the voices of our families and of the community.
I think too, just to piggyback on that, I think it's the way that we have looked at it is we're looking at caregivers, we're looking at clinic, we're looking at the community, and we desire to build on that. We, like both Debbie and Ellie said, the clinic can only do so much, and we really desire to bring awareness to the community, but also build adult capabilities as a strategy to improve early relational health and social emotional development. If parents don't know what it is, if they don't know how to parent, if they don't recognize those moments of interaction and building relationship, then they can't build on it. And we want to elevate and support and educate parents and have that trickle down as well.
That's really interesting. We've heard from some other folks, there's a part of this work that seems to be around parenting, parent education, sort of raising awareness around the importance of early relational health. Then there's a component of the work that seems to really center on the transformation of the practice, how the professional partners with the parent, and I would love to hear a little bit more about what those two things look like in practice for you. Maybe starting with what the practice had to do in order to adopt this way of relating to community and family. Or was that easy? What helped you do it? What hindered you? Sort of tell us a little bit more about that.
So it's interesting because we're almost not quite there yet. And so we've actually, kind of flipped the script on that. And what we have done and prioritized first is supporting and strengthening the infrastructure of our parent advisory team and our parent leaders so that they have a cohesive foundation. And I can let Tiffany and Zulma and Danielle talk more about that part of things. And then like the clinic's gonna follow. So it's not, how did we get the clinic ready? We're going to get there, but first it's how do we get the parents ready to do this work and get involved. And so so we were really intentional about the directionality of this work, that it's not again, pediatrics supporting parents, but it's parents supporting pediatrics. So just being really intentional about the direction of that, where it's like it's not the clinic doing stuff and saying to the parents, hey, do you like this? Does this resonate with you? Is this what it is? It's talking to parents, getting parents up to, again, a lot of our parents already knew this or knew it in some intuitive way, but didn't maybe have the language or, the official terms of data to be able to say what this was, meaning early relational health. And then the next step is going to be coming back into the clinic. So that's a bit of a difference with our work compared to the other proof point communities, is that we started in the community. And so it's really that intersectionality of three components, which is, as Debbie mentioned earlier, and Catherine, I'd love if you could talk about this more, but like the community was already primed for it. We have some incredible parents and caregivers in our community, and then the clinic comes next. So Catherine, I don't know if you want to take a minute to talk about some of the community efforts like ECAP and other things that are happening to kind of, that's like the ethos of Durham right now.
Yeah, that I can do that. And it was interesting, Sarah, when you said your understanding of this is there's the kind of the component that's happening of change in the practice and the way the practice is, and there's a component around parent education, parent support, and I was waiting for maybe this is because it's the way that our team has framed it, but there's kind of this third component of a community that wants to focus on the pediatric parent relationship and support it, and that I think exists in Durham, not perfectly or everywhere and in all situations, but and thinking about this at least for 10, maybe 15 years, Durham's really been had a lot going on around early childhood and beginning to recognize the importance of this period of life and how the sort of public sector can better focus and support kids in those early years. And that has bred some various initiatives and opportunities, a lot of investment in pre-K, for example. The grant that I'm working on, the project I'm working on, is focused on lots of aspects of promoting social emotional health. But a few years ago, our county government, following the lead of the state of North Carolina, decided that they wanted to support the development of an early childhood action plan in Durham, and put a bunch of system leaders at the table to decide what was important for Durham. And it happened right at the beginning of the pandemic. I can't even retrace all of the steps, but there were some wise people in that mix right at the beginning who said, hold up, this is going to mean nothing if we don't put parents at this table and figure out what parents actually want. What are the goals for parents? So an early childhood action plan is sort of goals around early childhood, and flipped that process on its head, which has to be something that is very much community led, that it is an intentional sort of structure of power sharing with parents of young children and frontline providers at the helm, and they have called this initiative Grown in Durham. So we sometimes refer to it as ECAP or Early Childhood Action Plan. We were all involved in that in some ways. I mean, representatives of all of the institutions are involved in Grown in Durham, but it has been structured in a way that it was responsive first to a survey and focus group process of what are needs, and then the goals kind of developed around that, and now strategies being developed with intentional, like, parent frontline provider leadership. And PSP came along, or the opportunity to be a proof point community came along, fortunately, after that kind of flip had happened with Grown in Durham, and the way all of us were coming to understand what parent leadership and centering parent voice could actually look like in this kind of new schema. And so that PSP, we started almost from the beginning with, we're going to create a parent advisory team, or we're going to have parents help select the staffing of this almost. And then many things have happened. And the fact that Grown in Durham is out there as an initiative and connected to all of the sectors that care about supporting early childhood and young kids and their families means that there's just I'm losing the words for this, but there's a synchronicity around this effort in Durham and this sort of more focused effort at this very big clinic that everybody in Durham knows is the place that serves most Durham kids, and particularly most Durham kids who have Medicaid. So it's already sort of we know it's an important place to connect with kids and families. And yeah, so I've said too much, but that's it. That sort of third wheel is community, and that is what helped birth this, I think, but also is now there to support it. So I'm going to go back to one of you to talk about what the parent education piece looks like in development.
I want to bridge you, Catherine, because
Okay,
we're
good.
talking about Grown in Durham and ECAP, and I was a parent representative with that group. And so the kind of the bridge, the carrying on, or the continuation of the attempt was that I interviewed for a position as a project lead. There were some specific things that they were looking for. Number one, a parent of young children. Number two, someone who had lived experience and lived in the community, and potentially someone who was representative of the population, meaning Black or Brown. That turned into an experience where I was able to be groomed more for my community advocacy, kind of role. But the other thing that I did, Danielle and I have been doing together, is developing more people, developing other parents. With our parent education suite specifically, we're able to give our parents the ability to come to the table comfortably. And on the flip side, for the clinic and pediatricians, being able to hear them, to genuinely hear them. Like our parent education suite is for the parents, but the parents in our focus groups and listening sessions told us they wanted to hear and see themselves from the clinic, because the clinic does not represent our demographic. And so,
clinic staff, meaning
clinic staff. Yeah, correct. The clinic staff. We're about 40. No, I'm sorry if I combine them. We're about 85% Black or Brown population. And we are not, the clinic staff is completely opposite. And so, that intentionality, and for us to kind of identify ways that we could really get the work to happen, and to happen in a genuine way. I mean, like, I think one of your questions was what helps to accelerate or promote this work. We identified, a lot of things. Some things were barriers, some things were really good ways to collaborate. And I'll just throw it to the team for them to kind of, elaborate on that, but it was the early childhood action plan was a good starting point, a jumping off point. It modeled human-centered design, where the people who actually are affected are at the table, and then we took it forward, and it's been exciting.
And thank you so much, Tiffany.
Yep.
The other piece, from the clinic standpoint, when we were looking at this opportunity, we knew that we had a lot of caring people in our clinic who want to do great things for kids. We were rolling out some screening practices and supports within the clinic for our families. We have a team that works with our families, nurse clinicians, some case managers, access to the diaper bank, the food pantry, Reach Out and Read, Healthy Steps. And yet we were missing the intentional family voice. And that's what we really wanted to take the opportunity with this particular project, to be able to step back and listen and hear from our families of, what do you need? How do you need it? What would be helpful? And not pre-package something to say, here's what we've got for you. Don't you like it? And really just step back and say, this is what we're doing. These are some of the constraints that we have in our ecosystem. And where are we, and where can we go together, and be really open about that, taking the lessons that we learned from the early childhood action plan planning process, of not just saying, hey, that we check the box of family voice, but giving that voice power to help with the creation of what we're all doing together. And Zulma, I would love if you would like to talk a little bit about kind of your engagement and how it's come along. I mean, you've been such an incredible champion for families from so many different levels. We all just absolutely adore the work that you're doing, and could not do what we're doing without you. And just would love for you to walk us through that experience for you.
Thanks. And as a parent, it is hard to find that I am heard. It is hard. And then by having this program, or having you guys, Debbie, Ms. Ellison, Danielle, Tiffany, like, look at us and really ask, and ask us, what is it that we need? As a parent, it has like opened my eyes more. It has opened my eyes to, wow, the frustrations that I may have, it really wants to be heard. Like, they really want to address it. They really want to take it on and hear me, and hear my concerns, and hear my I want to learn. I want to know, so that we can better everything for our children, and at the same time, our community. And with that said, as a parent leader, I have this I guess a great resource put on me, to be able to listen to other parents and be able to represent them in these type of meetings, and say, this is what I've heard my co-parents, what I've heard caregivers, what I've heard other people say that they need, and let's try to address it and bring it more out of the shadows where most of the BIPOC community have been, and bring it out more, and make us more aware of what we do and what is needed to be able to do better and be better for everyone.
Can you be specific, Zulma, about how you've done that? What you specifically have contributed to the group? Because you being modest.
No, I mean,
she doesn't think about it, I think, honestly, but it's an amazing thing to be able to recruit and take the message, and
yeah, I mean, that's the way that I see it. By me by me listening to you guys and hearing and learning about all these resources and all these things going on, it gives me the power to go out there and spread the word. And education is definitely the key, I feel. And a lot of us, a lot of parents, a lot of caregivers, we don't know that it's out there. We don't know that someone is trying to really make it better. In our day-to-day, we forget that someone is trying to give you a voice, and that's what I try to do, to bring a voice to other parents. So I do try to bring more parents in and ask them, what clinic do you go to? What are you doing? Did you know? Things like that. Like, I do try to spread the word more, because it makes me feel great to hear a group trying to listen and really pay attention to what we need as parents and caregivers. But at the same time, I want to give the same, which is getting educated and spreading the education out there so that we can just be better.
I have a specific question. I would love to know from the side of the parents, what has surprised you in this partnership? Like, what is something you've learned that changed the way you thought? And same on the other side, from the provider perspective, or the other folks in the room, like, what have you learned from the parents that has actually changed the way that things have happened in practice? Do you have examples like that to share with us?
Well, for me, it's really just feeling heard. Like, I feel that you can see the difference when you ask someone a question. When we have asked questions in the parent meetings that we've had, you ask the question and you see it in their face, like, whoa, you really want to know? Like, you really want to know? Like, can I be free and really tell you how I feel? And that within itself gives power to the parent, to me. It really, to ask somebody, what does this make you feel? Or how did you feel? And just listen, it gives a type of empowerment that most of us don't feel we had, especially in the medical system. Sometimes we get there 15 minutes, you're in, you're out, you kind of just like, you didn't know. But that's what I feel as a parent.
I would say from the clinic side, certainly one of the things that's been uncomfortable, I don't know that it's necessarily been a surprise, but something, well, maybe it's a surprise, I don't know, that's been uncomfortable is this flipped role of I am not in charge. I am not the leader. I am not running this project. And having to answer questions that pushed me to think more about what we're doing and why we're doing it. So for example, our Healthy Steps program is a program that really supports a lot of early relational health practices in our clinic. But it was a real question in the beginning. It's like, what is Healthy Steps? Who are they? Does the clinic or does the community and do families really, do they really want this, or do they want something else? And, at first I was like, of course they want Healthy Steps. Healthy Steps is a great program. It's, evidence-based, blah, 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 blah. And then it was like, well, wait, like, okay, let's really think about this, and let's really think about, what we're doing. We've had so many conversations where I'll talk about, the ways that I'll ask families questions, and the response I get is, "Oh, no, Ellie, don't use those words. That's not a great way to ask that question." Which I didn't know, I didn't realize. And so, I think that part of things of just, that sitting with that discomfort of not being in the lead, not being in charge, has been great, and has allowed us to grow so much. And I think that, again, not fully a surprise, but maybe something I didn't appreciate as much is how important our relationships are with each other, and how important it is that we all trust each other, and are transparent with each other about, this is coming up for me. I'm feeling some kind of way about this. We need a vibe check. Things aren't feeling right now. Like how much time that took. I mean, probably not, as much time as other people, because we're all really cool and really like each other. But, it just that like but that is so much of the work by itself. Is just to establish, so that Zolma can say, hey, like, I know these doctors. I know this clinic. I know what's going on. And again, sort of validate. And we're not trying to do this in like a tell them we're okay, sort of way, but like it's more authentic than perhaps I'm making it sound. But somebody save me. But really, I think there are a lot of shifts that have happened, that have been uncomfortable in different places, and working through them has been tremendously rewarding.
I think too, thanks Ellie for that too. Just like I want to continue to elevate the community side, because it's just this mediation pieces. It's three components really, because we sit in this unique space where we have folks that are supporting the work, that are representative of the community that we want to engage, yet have experience and expertise within maternal child health, or like leading and managing and facilitating. Like there's the experience, and then there's the education, and then there's the representation, and it all sits in this third component of community. And we stand in a space where if parents have a question, they can say, okay, well, what is this? Or what is that? Wait, what is ACEs? Explain, what does that even mean? What is social emotional development? Like, what does that even mean? And we can stand in that space and say, this is what they're saying, right? And this is what that looks like. Or to be able to, like, going back to what Ellie said, ask a question like, how would you say this? How do you say this? Like, does that sound okay to you? And to be able to have a trusting relationship where you can say, I would say it this way, or maybe word it that way. I think what's really unique about our team is that we are a group of individuals who are passionate about families and early relational health and social emotional development, and seeing them all thrive and be successful. And our humanity and love around that comes first. And then we have our specialty. Then we have our alphabets, if you will. And that's our core. We center relationship and support and development. So we're trying to mirror that for the community. It's been awesome to have this co-design process and this bi-directional learning where there isn't a lead, but we all have our individual roles and we're getting the work done. And I can ask Zolma, I don't understand why we wouldn't want to translate something this way. What does it convey to your group? Like, what is your representative for parents, or your representative for the Hispanic community? What does that mean? What does that say to them? And it's like, you don't want to say it that way, right? You don't want to word it that way, because that gives a different meaning. Okay, fine. So we're learning from community. We're learning from parents. We're learning from the clinic. It's like, what parameters do you all have to follow from a clinic perspective that we need to be aware of when we're making suggestions and desiring to have certain changes in the clinic? What constraints do you all have to fall within? And then we can take those into consideration and shape our asks so that it's not difficult for you. Like, we understand that they have rules that they have to follow too, and being able to convey that to parents as well. And it's this synergy. We're just learning from each other and hopefully doing exactly what we want to do and improve the lives of folks in Durham County. So.
And I'll just say, like, we're not hiding anything. This was not without bumps on the front end. Like Ellie mentioned, we originally kind of started off with a different core group. And the intentionality was completely, lived experience has to be here. People who are representative have to be here. And we learned from that experience that's where we need to begin to develop our parents. That's where the enhanced adult capabilities kind of came into. So it was a hard, hard stop almost bump. Like, like maybe we're not gonna have a plan. Where are the people? But the wonderful thing was, like Danielle mentioned, the work came first. And if you weren't here for the right reasons, which was because of the work, then this wasn't the right place, for you to be. And some people, kind of had to make that self-assessment and bow out in different ways. But so it wasn't perfect to get to the point that we got, but I will tell you, like, the rewards of being where we are now are amazing, just amazing. We're seeing what we wanted happen with our parents. Zulma is a great representative for our parent advisory team, but we've got an amazing group of parent advisory team members. There are probably 4 who we are seeing develop to the point that when it comes time for the clinic to offer positions, we would say, this would be a great person, that would be a great person, I would give a reference for this person, because they're hungry for the work, passionate about what we're doing, and they're showing up and they're learning. I mean, like, we're doing community health worker certifications. We're certifying them on protective factors. And when we started it, they were like, oh my gosh, this is wonderful. Like, so that's where we are. We're seeing the work really thrive and be important. And hopefully at the end of the 3 years, we're going to see, like, it have a place of its own and just really be floating into the community wholly.
And I wonder what would have happened if, I'm sorry, Sarah, I'll let you ask a question in a moment. I wonder what would have happened if we had offered those trainings on, like, a flyer on the wall in the clinic. Right, Zulma's face, right? Absolutely not. I'm not coming to that. I think about that in terms of, like, a lot of the things that clinics will often do to promote early relational health is like, why don't you take this parenting class? And, like, coming from me,
Right.
like, absolutely not. So I just think again about that intentional directionality of how this is working,
Right.
and how much more of an impact, so that we have parents in our community who are like, sign me up, I want more, rather than this weird smattering of offerings that clinics often give. And we're like, here, we presented you with all these things, but it's not actually getting anybody anywhere.
Right. There were some people who rolled into our parent advisory team from the early childhood action plan. But we found Zulma from posting on Facebook. I didn't know her from John Jacob Jingle, but we needed 4 more slots, and we wanted to look towards our community group, and we wanted to ensure we actually found our Caucasian female who was pregnant, and got her from Facebook, recruited her from Facebook. She actually was the post was, I'm a parent, we're working on this project, who are parents, and actually go to the clinic. And they showed up and just amazingly are contributing to, the group, giving voice. So it's been really, really amazing to watch, honestly.
So I'm hearing that there are some keys to success that have sort of come together, collided synergistically in your community. One, that there was sort of a foundation, community-wide action plan, some other initiatives happening that sort of had aligned values and goals, but really the time you took to build relationship, both in your core team, but across the with parents, to increase trust, it seems, with the services, and so that can then trickle out also to other community members, that will eventually sort of reinforce itself. And you're building a pipeline of representative individuals who could potentially take jobs in the future at the clinic. Is that generally what?
Yeah, it wasn't just lip service. We're really following through. And I think that that's one thing that's different too. There's a lot of times where you do a focus group with a group of parents, but then does anything happen with that information? And do they know what happened with the information? Those are two things that we're very intentional about. First of all, they're seeing the results, and they're getting that communication about the results that we took from them. So they're seeing the front end and the back end. And like Zulma has mentioned, it's a different feeling. It's really appreciated, by the parents.
Amazing. I am curious, in other conversations we've had with folks who are working specifically around ERH and healthcare. Often the entry point is with families who have experiences with children who have a lot of special medical or healthcare needs. I mean, there's no better way to experience all the barriers that potentially exist in a given system until you have all the need, right? And you're very invested in that, right? And I heard that from both of you. I'm curious, in your grouping of parents that are engaged, what are some? Have you found that it's harder, or you've been able to engage parents that don't have that connection to the healthcare system? Or is it really sort of not still? I mean, I think that's an important group, but one of the goals of Nurture Connection is to figure out how do we get this sort of for all children, whether they recognize their need for special healthcare intervention, It's my question.
Yeah, I think that being ECAP kind of, again, primed the community for our work. And that initiative brought a lot of folks that may have entered into healthcare, had that experience with healthcare. That brought a lot of folks to ECAP. And then we were able to benefit from that. However, there was another component where, and Tiffany has said this, we put blast out on social media, which was a limitation that the clinic had, right? So they couldn't use social media the way a community-based organization could use social media. So we were able to tap from social media. We were able to pull from ECAP and garner some parents that may have had those unique experiences. And then also pull from the clinic, and the community-based organization that we work with as well has parents that have children within the age group that we were looking for. So we were able to utilize relationships and social media to really find some other families to participate. And as far as let's see, differently abled kiddos, we have a nice balance in our parent advisory team. Like we have a nice balance in who participates. Is definitely reflective of the clinic and the clinic population, but we have those who may have children with special needs, maybe not so much. So I would say we're pretty reflective.
And also,
and I think
I'm sorry.
Oh, no, that's fine. I think, one of the other things about it is that oftentimes, you do see that kind of, if I've had a negative lived experience with a system, I want to do something that is going to improve that system. Right. And so you sort of have people who've had, negative or overly represented interactions with the healthcare system because their child has special needs or whatever. But this group, I think, is focused more on the benefit of lifting all children. And so I think that also kind of solicits a different group where it's just like, we are trying to find ways to support
Everyone.
the social emotional health and social emotional development of our community's children.
Mm.
And so I think,
apologies.
Yeah.
Like even in our group, we even have someone that was pregnant and now the baby's now born, and she was in our group as she was going to deliver. So it's like from the beginning for her to understand that it matters what you feel, what you think, and that, you know, we have such an open space for you to be able to ask, for you to be able to speak up. So I think that just then you're giving a parent the power to be able to open up and be more one-on-one with a doctor, or one-on-one with the receptionist, or one-on-one with anybody that she may need to when she comes to the clinic. I think it does give power, and I think that our group is very broad in different types of, like, we have male parents, you know, and things like that. So I think that it definitely has a lot of dynamic, different people.
That same parent that Zolma was referencing at our last parent advisory team meeting needed parent support in a different manner. And Danielle and I, you know, co-lead this group. And so Danielle was able to step into her doula role and walk out, you know, take that mom out and help her to woosah and help her to learn some strategies. So I would say, you know, our team has worked really hard on using our experiences and our lived experiences, but also, I mean, we're being developed. I'm taking as many classes as I can. Danielle and I are training together on maternal health begins at birth, and we're doing care training, which CCFH, that Catherine and Catherine's group sponsors. I mean, there's so many ways that we're not looking for those, you know, kind of special needs, you know, folks, but we've identified them. And when we've identified them, we've been able to make some adjustments or changes. We found out one of the parents was actually legally blind. She had a huge visual impairment, and my son's visual impairment, you know, was what drew that out of her. So you don't have to, you know, kind of start to highlight those things on the front end. I mean, sometimes you got to give people time to really share their stories, and not everybody's at the same point of comfort. But when it arises, are we prepared as a group to be resourceful for them? And I think that that's what we're doing. We're, even when we don't know it, we're finding the resources, or we're trying to work with our group however we can. And this is a pilot with our parent advisory team. The next step is the clinic parents in general. We have what's our percentage of parents who are actually at the clinic? I'm at the clinic, but who else? And Zolma's at the clinic.
It's almost 95%. I think we're all but one. But to piggyback on what you were saying too, yeah, me, right? So like, and one other, but to piggyback on what Tiffany was saying, one of the things that we wanted to do, and I'm mindful of our time, but one of the things that our parents asked for was an environment in the clinic that was family friendly. And because Tiffany's child and the parent had this similar need, we were able to say, okay, if we're going to put, let's say, this type of artwork in the clinic, let's make sure that certain components of our artwork is either black or white, very bold. We can be more inclusive about even the selection of artwork that we're putting in the clinic, because we know these things about our families and what they need. So we can have some pastels that will work great, but then not so much on the other side. So it really highlighted this opportunity to be inclusive and intentional.
I love that. So again, I think it boils back down to taking the time to really be intentional and thoughtful about who you recruit, how you recruit, and what's the pathway for inclusion. I have one last question, and Stephen and Melinda, you guys should feel free to put some questions in the chat if you want. We only have 1 minute left, but you know, Nurture Connection is a national initiative. It's a network that that's trying to build a movement to advance early relational health. They envision a future where every family experiences the joy and benefit of strong, positive, and nurturing relationships, and where every community and all systems support that emotional connection between the parent or caregiver and baby and toddler, and where ERH is really seen as vital to creating a healthier society. Like I said, we do this by building a network and an engaged movement, of which we hope you feel part of. But if you were to give advice out to this national network, What do you think that they need to be advocating for so that groups like yours or other communities that are trying to do what you're doing can do what they're doing better, so that more families and more systems can sort of really drink in the importance of ERH?
Well, in my eyes, I think is just understanding that you need to listen, that we as parents and are the community that needs it, and you guys are able to provide it. And by just listening on what is needed, or you can get to a point where you see the change that this will bring. You'll see more change. It's going to get better if you listen on what the need is really is, underneath everything. And I feel that, we definitely do that. I'm very excited, like I said, to move forward and be part of more groups so that we are able to address everything that needs to be addressed to give a better tomorrow for, our families and our children. Yeah.
We have a new hashtag, and it's hashtag absorb and radiate. And that's Zulma. That's her. And so one of the things that I would add as that advice would be, find a way to create an environment for your parents that will enable them to absorb and radiate. I mean, give them whatever resources and tools they need. For us, one thing was language. Parent language and clinic language is completely different. And there were so many times where Zulma, Danielle, and I sat in meetings with Ellie and Debbie and PSP National Set, and we were like, what does that mean? But we had a space to ask.
Yeah, safe space.
We had a safe space to ask Debbie and Ellie. I'm making y'all one. I'm doing like a anyway, but yeah, so
Belly, I love it.
right. I think that's important too. The need for better different language was highlighted, or we found that out, and then we compensated for it. We made a way for it.
Yeah, I think with language also, thinking about that as a barrier for participation, both the language we're using in our conversations, but also this is the first group I've been part of, and this built on, again, what Grown in Durham has done, that has simultaneous interpretation at the meetings. So it's not that, you need to be, bilingual to participate in the meetings. It's that you cannot speak, if you do not speak English, that's cool. Come on, like we have a simultaneous interpreter for you. That is something I've never seen. And so the other thing is just, I would recommend to others trying to do this is to not rush the outcomes part too fast. One of the things that I've given back to the PSP group has to sort of say, like, so many grants that we work on, so many groups that we're a part of are, what is your project, right? What is the project going to be? But thinking about, how do you build in 3 months, 6 months, an entire year, where the only goal is building relationships and trust. There are no outcomes, there are no deliverables, there's nothing other than, did y'all get together for coffee with your local, CDSA, WIC group, parent-led organization. And for that to be a foundational component of trying to do this work, instead of trying to shoehorn it in with all the other, and then we're going to start screening for this. So that would be my advice.
I think that something that I did come to my mind, it's not just the language, like the translation. It's really, even when you are speaking English, keeping it simple, because you guys have a lot of terms that, I sometimes, question and try to put two and two together, and I'll get to it. but definitely knowing the audience. And sometimes when we use big words and flyers, and you start reading, as me as a parent, I start reading, you lost me because it was too much. And those words were too big. And it's just on our day-to-day life, too much. And I think that maybe like put it down a bit with these big words that a lot of organizations tend to use. It's very important. Not just the Spanish to English, the English to something else. And it's not just that, it's just plain words is really captures more, I feel. But that's something that I would give.
I think too, it's just eliminating or reducing the walls. There's this idea of concept of otherism. It's their problem and we're here to solve it, or they need this and we have the resources. This group is it's a very wonderful example of power sharing. Again, we come together as a group who has passion around supporting families in Durham County, supporting families in North Carolina, supporting families, right? That's our goal, supporting families. We have been transparent. We have bumped heads. We have cried. We have laughed. We have done all the things that stoke a healthy relationship and moved forward from those things, right? And if those folks who desire to do this work could understand that they are doing it in relationship with people, that again, just bringing your humanity to the front. This is not someone down the street that, or on the other side of the tracks. No, we are a family. We come together in our humanity. We support each other. Everyone wants to have healthy kids and healthy families. And if we can continue to put that in the forefront and drive and strive for that, then we can be successful. We're all on the same team. We're all on the same team. So if you could approach this work with that in mind, it could drive success.
Any other last words? That was beautiful.
How can you follow that? Right. That's
so nice.
Mic drop right there. Yeah.
Oh, and we have a special visitor right at the end.
She's shy. Had to bring her to work today.
Well, welcome. Well, thank you so much for giving us your time and sharing your experience. We hope this is just one conversation, and there will be many more and more opportunities to learn from each other. Stephen and Mia, who had to drop off, are part of our the family leadership. Oh my gosh, Family Leadership Council
Network Collaborative.
Oh my gosh, I'm combining acronyms. Speaking of acronyms, and they, much of what you said, they also have experience to talk a lot about living room language and how do you connect with other parents and how do we give time to build trust and space. But good partners for you guys to know as well. I'm sure there's lots to share there. We will be in touch. This recording will go out to the rest of the steering committee, and I'm sure they will be really excited to learn everything that you've had to share today. If you have questions for us in the meantime, please don't hesitate. Melinda and I are always available to answer questions, to jump on a phone, to have a conversation. And I'm sure many of you know David Willis and other folks who are part of Nurture Connection. So, feel free to reach out if you have things that you want to bring forward to the group. We're also happy to share those.
Thanks so much.
Thank you so much.
Thank you. Thanks
for the opportunity.
Thanks. Have a great day.
Take care. Bye.
Thank you.
Zulma.
Yes, I'm trying.
Yo tengo familia en El Salvador.
Sí, yo acabo de venir de El Salvador. I just came back like 3 weeks ago. We went for 5 weeks.
Wow.
We took the kids because they needed to see and learn how the culture is over there and how great they have it here. So yeah, we had a great time. But it was nice to meet you guys. I was having a hard time with this leave button. Thank you guys.
Oh,
Bye.
no. Thank you for being here. Bye. All right.